Welcome, folks. We're glad you're here. We'll give you folks just a couple minutes to pop on. We're not quite at 10:30 yet. We'll give people just a beat, but glad to see your faces and have you join us this morning. Well, I'm Kate Bowles. I'm the president and CEO here at the Community Health Endowment. We're really pleased to have so many of you join us this morning to our returning applicant workshop. This workshop is for folks who've worked through our grant application process before, so we'll move a little bit more quickly, but feel free to stop us or slow us down if there's anything that's unclear you'd like to hear more about. We will try to highlight the things that are different this cycle, and let you rely on your experience for other pieces. So if you're joining us as a returning applicant, then you're probably familiar already that CHE's vision is to make Lincoln the healthiest city in the nation. We were funded by the proceeds of the sale of Lincoln General Hospital and continue to remain committed to promoting health and well-being in the city of Lincoln. Today's presentation will cover our funding approach, our data priorities, and a little bit about our application process. It will be interactive. We will be recording. I think I noticed a couple of note takers on the call too. So just so you're aware, there will be documentation of this presentation. There is also closed captioning capability. You can raise your hand, you can jump in the chat, and then you can also use the live captions if that's helpful to you under the language settings as represented here. So a little bit about our funding approach. We want you to know that our funding priorities have changed. We had the same funding priorities for about 5 years, and the board did decide to adjust those for the next funding cycle. Our 3 priorities are access to healthcare for targeted populations, including understanding of and access to primary care physicians and insurance for populations where disparities exist, particularly partnering with representative community members, access to healthy food for targeted populations that face disparities, and mental health access for targeted populations, including increasing awareness of and access to mental health services. What do we mean by targeted populations? To CHE, that means that they are groups of people where data show that there are disparities or barriers to health, such as data evidenced in Place Matters, Lincoln Vital Signs, the Community Health Assessment, or other local data sources. CHE particularly values projects that demonstrate deep impact, leverage additional funds, address disparities, and build partnerships. So I want to take just a minute and say these 3 priorities are kind of our new focus area for the next 2 years. we're looking for projects that both address access to healthcare, or healthy food access or mental health services, and are serving a targeted population. So folks who might otherwise have challenges to accessing healthcare. I'll give you a few examples in a future slide. In addition to our new funding priorities, we now have a new technical assistance program pilot. This is really designed to help organizations build their strength and capacity. In the past, we've typically funded program services or capital construction. Anyway, in other words, service provision to individuals in our community or capital construction. This is an opportunity for you to strengthen your organization through planning, evaluation, or training. We have a total allocation of $50,000, and we expect to fund 2 or 3 grant projects in this area. So we'll talk about it as we go through this presentation, but it is a separate funding application. You may apply for both the fall funding cycle and the technical assistance grant. It's just an opportunity for you to think about what your organization might need to continue to serve folks in Lincoln. We do fund 1, 2, and 3-year grants. We do fund capital and equipment expenses. Those do require a 1-to-1 match. And we do fund indirect costs as long as they don't exceed 15% of the grant request from CHE. We don't fund individuals, research, though evaluation and quality assurance are allowed, lobbying, political parties, or debt reduction. We often get the question, how do we choose? We have a 15-member board of trustees that represent healthcare, human services, financial, and community expertise. That board does make the final choice. They have an interest in projects that promote health equity and are data-driven. It's a combination of reviewing your application materials and discussion among the board members. So some examples of previously funded projects can be found on our website. Some examples include we funded the Asian Community and Cultural Center to expand prenatal care services to immigrant and refugee clients. We funded the Food Bank of Lincoln with their Lincoln Fresh Food Truck, delivering fresh produce to targeted neighborhoods in Lincoln. And we just funded At Ease USA, which will provide peer support and wellness programming to veterans at risk. So each of these is an example of one of our new funding priorities. The Asian Community and Cultural Center, I think, is an example of the kind of project we might fund under healthcare access. The Food Bank of Lincoln is the kind of project we might fund under healthy food access. And At Ease USA is the kind of project we might fund under mental health access. You'll note that each of these has a targeted population. So the Asian Community and Cultural Center is focusing on immigrant and refugee clients. The Food Bank of Lincoln is targeting low-income geographic areas, and At Ease USA is serving veterans. The board is looking for applications that consider health equity and targeted populations. The definition of health equity, according to the CDC, is the state in which everyone has a fair and just opportunity to attain their highest level of health. And as we've referenced, targeted populations are folks that data show face disparities. Our website includes access to some information around Place Matters, Lincoln Vital Signs, the Community Health Assessment, and other local data sources. Your data sources are valid as well, as are your own organizational metrics and measurements. We're just looking for a data-driven approach. Place Matters is the publication that the Community Health Endowment publishes ourselves. It's a geographic-based publication that shows a number of health-related measures and themes related to health access, health outcomes, and social determinants of health. So this is an example of a map that we produce. It's the Social Vulnerability Index, which rolls up a number of health-related factors to identify where the highest needs might be. So this is the kind of information you might use to make an argument for the application that you submit. Additional data resources are available on the website. You're not limited to these data resources. We just want to give you some information and assistance as you're thinking about how to target the strategies that you're considering. I'm going to pause there and just ask if there are any questions about our funding approach or anything that I've shared so far before I turn the keys over to Morgan to talk a little bit about the application process. Anything related to our new funding priorities, our technical assistance grant program, or the data that we're looking for in your application. Okay. If something pops into your head, feel free to speak up or join the chat. I'm going to turn the reins over to Morgan, who's going to tell you a little bit about our application process.
Awesome. Thank you, Kate. So I'm going to start with this infographic of our application process. It hasn't changed too much, but something that may be somewhat new for returning applicants, especially if you haven't applied in the last year or two, is the eligibility form. So after applications open, which happened yesterday, there's an applicant workshop. You all are a part of that right now. Then the next step is the eligibility form, which you actually fill out on our grant portal that we call Foundant. And separate eligibility forms are required for the two applications for the fall cycle and the technical assistance grant. They're just very short forms. They ask about the geographic location of your project, whether your organization's in good standing, just a very brief project description of what you have in mind. And I like to note to applicants that these eligibility forms are not provided to trustees. The trustees will only see your grant application that comes out of this. The eligibility form is what leads into the one-on-one idea meetings. So it gives staff an idea of what your project may be going into these optional but highly encouraged meetings. The idea meetings are a 30-minute meeting with CHE staff to talk about your idea, to discuss ways that you could make it stronger, to discuss any ways you could leverage additional funding in the community, partner with other organizations, talk about the issue at hand. And these are available through July 17th. Again, you need to fill out an eligibility form prior to scheduling a one-on-one meeting. And we do encourage you to do this sooner rather than later. It takes a couple days for staff to review your eligibility form, send you the email with a link to schedule the idea meeting, and then for you to reserve some time. And meetings can get filled up relatively quickly the closer we get to the end date of that. Again, the eligibility forms, just a few quick questions, and you'll receive a response from staff via email. Anything to add, Kate, regarding the eligibility form or idea meetings?
Awesome. Just get on the calendar as soon as you make the decision to apply. Those idea meetings can fill up fast, and we want to make sure you continue to be able to access what you need to apply.
Perfect. So the application for both grants are available on the CHE grant portal. That can be found through the website, the CHE website. It's pretty much linked on every page related to our funding and also in the main menu. I'll show that to you here in a second. Something important to note is that there can only be one main contact for each organization. So make sure that whoever is receiving these emails is aware that they'll be receiving these emails. Make sure they're the correct person and that email is getting checked. Sometimes organizations have very general email addresses for the contacts, such as grants at organization.org, which is fine, but make sure that someone's monitoring that email, because that's where you'll receive all of the quarterly report reminders, any questions that may be sent to the applicant during the application review process may be sent through Foundant as well. Something else you may be familiar with, but I want to remind everyone, is the collaborator function. This is available on each application page, as well as if an application is approved within the quarterly reports. So this is for you to invite someone from either inside your organization or outside your organization to either view, edit, or submit a form or application. So this could be a contractor if you're working with an external grant writer. This could be a partner if you're partnering with another organization, or a fiscal sponsor on the grant. We encourage you to use that collaborator button, and you can choose as many people as you like. They will receive an email notification that they've been added. Just a reminder about the work plan. There are 3 different templates required throughout the application process. This is the first one. There is an example at the top of the template that you can review for clarity. We just ask for clear goals, breaking the goals down into action steps that are measurable, assigning responsibilities, so clearly stating who does what, and then setting realistic timelines. For example, this training will be completed by March, or sessions are held April through June. This isn't necessarily set in stone. We understand projects sometimes change. There's sometimes where an application is approved that an updated work plan might be required prior to contract drafting. But just fill this out to the best of your ability and make it as specific as you can with what you know now, with the information you currently have. The second template provided to you within the grant application is the budget form. We also require this template. There's 2 tabs per Excel workbook. There's a support tab and an expense tab. This form has not changed in a while, so if you're a returning applicant, you should be familiar with this. We need a new workbook for each funding year requested. If you only request 1 year of funding, then we only need 1 Excel document. If you request 3 years, we'll need 3. There is a space on the application to provide an explanation of your budget in case there's anything that you feel needs further commentary. Here's a sample of the budget template. This is the support page. Everything in gray is locked. You don't have to fill out anything that's in the gray. The only places you're able to type is the highlighted yellow and then the white cells. The support tab requested of CHE is just at the very top. There's only 1 number that's of the requested, and you'll break that requested amount down in the expense tab. The support tab is for other support you'll be receiving for the specific program or project that you're applying for a grant for, not your overall organization. So for example, if your project is to provide 100 healthy meals at a local organization, and you're asking us to provide funding for the event space to provide those healthy meals, we'll want to see on here other support. Where are you getting that support to buy those meals, to purchase that healthy food? The board will want to see that. So we don't need other support for your general overall organization. It'll just be for whatever's in your grant application and on your work plan. The letter of commitment is the 3rd template provided by CHE. This is not required, but encouraged. You can provide up to 3 letters, and we ask that you do use the template. It just makes it easier for those writing the commitment, and it standardizes the process for our board of trustees. It helps make everything consistent and fair among our applicants. And as a reminder, a letter of commitment is a specific promise from a partner of what they're going to provide to you throughout the project, not a letter of support. So what we don't want is a partner organization saying, we really love this organization. They're doing great work in the community and we think you should fund them. We don't need those letters of commitment. If that's all you have, you don't need to upload anything. There are smaller projects where maybe you don't have letters of commitment. But if you're going to be partnering with someone, and I'll go back to my example of providing healthy meals for kids, maybe you're partnering with the Food Bank of Lincoln to source those healthy meals. And so you'll want a letter of commitment from the food bank saying, yes, we're planning to work with them on this project. We've already talked about it. We're in, we're game. And you can include that letter of commitment. Again, it's not required if it's a smaller project. The board will understand why there's no letter of commitment. It won't be held against you, but if you do have a project where it's clear in your application and your work plan where you are working with other organizations and leveraging other funding, it would strengthen your application to have letters of commitment. So after the applications are submitted, which is July 31st at noon, that's the due date, the applications are reviewed by our Board of Trustees. They review each one very carefully, including the work plans, the budgets. The application also requires you uploading organizational financials and audits, which staff carefully review and provide to the board as well if necessary. After the board makes the final decisions, the applicants are notified of their decisions. Contracts are then drafted and signed through DocuSign. Proof of insurance is submitted to CHE. This is general liability, workers' comp, and then if it's related to your program, any automobile insurance. And then the grant period begins, and that's when funding is available to you all. After the grant period begins, we have a grantee gathering. Some of you may be familiar with this, where we meet and go over the process of the grant life cycle. We have quarterly reports where we stay up to date on all the great work you're doing in the community, or any help or assistance or pivots that need to be made along the course of your project. And then if it makes sense, we will have our board and or staff come do a site visit to your organization. We love to hear about personal impact stories. We love to hear directly from the clients who are impacted. We love to see your work in action. It may not make sense for every organization to have a site visit, but if it does, you can expect that we would reach out to you for that. And then the grant's closed after the deliverables are met. Sometimes it may take longer than the grant contract period to reach the deliverables, and that's okay. The goal is that the money is spent in the way the board intended, and that the deliverables are met. So while we do aim to complete the grant in the contract period, we ask that you just stay in communication with us, be honest on your quarterly reports, but we'll go through all of this more in the grantee gathering. So I did want to go through a live walkthrough. I'm not going to walk through the whole application because you're aware of this. I just want to show you one page. I can. So the one page I want to show you is due to the fact that Foundant, our grant portal system, recently updated their homepage. I would say in the last year. So if you have not applied in the last year, this homepage will look new to you. They have it separated into buckets. So if you have applied, you'll see items here, maybe under historical. If you have an active grant already, maybe under action needed. But if you haven't applied in the last year, you may not see anything. Or maybe your organization has applied before. You've applied with a different organization, we've transferred your contact, things aren't showing up for you, work with us on that and we can provide the necessary credentials for that. To apply, you click on this top left-hand button. And here you'll see our two separate applications, one for the fall grant cycle, one for the technical assistance grant pilot. You can click see more to see any additional details that's helpful for both. And then you can also click preview if you would like to see a PDF example of the questions before you actually apply. You can see the full application here. Finally, just to note, for those of you who may have not applied in the last couple years, when you click apply, you'll be taken to the eligibility form to submit for an idea meeting. This is the first step. It's required in both of the application processes. You have to click submit application for it to go through. Sometimes that can scare people because they think it's submitting a formal application. It's not. Staff will review it. If you're eligible, we'll reopen the application and let you know that you can go back in and you'll be able to see all of the questions. Any questions so far while I'm pulling the slides back up? Awesome. I'll keep going then. This is our current grant budget and our obligations. The current obligations, those are just grants that have already been awarded for multi-years. So the available balance in this upcoming fiscal year is $1.2 million. The board has the ability to award that however they would like. If they'd like to award it all in spring, all in fall, typically we see a relatively general split, but it's up to them in the end. This does not include the $50,000 that's set aside for the new technical assistance grant program. Reminder, the funding calendar applications are due July 1st. The grant portal closes at noon, so make sure you have everything in before then. Grantees are notified on October 30th. And then the grant period begins January 1 of 2027. Can't believe we're already talking about 2027. Again, there's frequently asked questions on the website, data resources on the website. There's a resource download available specifically for the technical assistance grant. We try to have everything we need for you, or everything you may need, available through the applications. It's all linked. It's all on our website, but we're human. If we miss something, if there's a link that's not working, if something doesn't make sense, please reach out to us, give us a call. We won't be offended. We would love to work with you through it. And we're always open to suggestions as well. Just a quick reminders. This has all been mentioned. And then we do have an exciting save the date. Kate, do you want to cover this?
Sure thing. Because the board did choose new funding priorities, access to healthcare, access to healthy food, and access to mental health, we wanted to also offer some training and support. We're partnering with Walther Seck Associates to do a workshop that will help applicants to think about what your outcomes might be, connect the dots to data collection, best practices, that sort of thing, but also use what you already have. We know that a lot of nonprofits, people wear multiple hats. There are only so many hours in the day. So Walther Seck are prepared to help you think about how to use the resources already at your disposal and make it as simple as possible. So the workshop will be held in the morning, and then we'll offer some time slots for one-on-one sessions with Janelle and Brian if you want to talk through your organization's particular circumstances. So a more official invitation will be coming out soon, but for those of you on the call, you might want to save the date on your calendar if that's of interest to you. We hope you'll join us.
All right, we have 2 minutes to spare. Do we have any questions?
Just to highlight quickly something for all of you as returning applicants. we have gotten the question, what about funding priorities that you funded in the past, specifically social connections and youth fitness? Those are not in our funding priorities currently. If you have a project that is youth fitness but also offers healthy food, or you have a project that offers peer support as a social connection, but also as a mental health support, you can apply in our mental health funding priority area or our healthy food funding priority area. But we are not accepting applications currently for projects that are simply youth fitness or mostly social connections. There's a difference here in our funding priorities. You can, one of our previous funding priorities was access to prenatal care. That fits under our access to healthcare priority. And mental health remains a priority. So just for clarity, for those of you who are returning applicants. If there aren't any other burning questions, I have a quick favor to ask, which is if you have a question or concern, or you have an individual follow-up, would you put your name in the chat and we'll circle back to you. If there's something unresolved, put your name and contact information there and we'll circle up. But if you've gotten what you've needed from this presentation this morning, would you give me a quick thumbs up, just so that we know you've got what you need to move forward with an application? Fantastic. I really appreciate that. If there's anything remaining, we can hang out for a minute if you want to stick around and ask your question, or if you want to put your name in the chat for a follow-up, happy to do that. Otherwise, get on the schedule by filling out your eligibility form and signing up for an IDEA meeting. And we'd love to see an application from all of you. Thanks for your time. Okay, have a great day, you guys.